Hi everyone, and welcome to the Pediatric Theory course. This course is the first of 3 in the Pediatric Nursing program, and it is the prerequisite for the Pediatric Skills course and the Pediatric Clinical Experience. Caring for pediatric patients and their families can be a scary prospect for many nurses, and it is my hope that by the end of this program, you will be comfortable providing care to children and their families. I envision you all being able to work in your home facilities as pediatric champions, the go-to people for pediatric care. For some of you, this will be your first experience with pediatric nursing knowledge, and for others, this will be a refresher. The purpose of this first learning module is to review and highlight the important points of the course syllabus that is provided on the course website. The Pediatric Theory course provides learners with the foundational knowledge needed to provide nursing care to pediatric patients and their families. It will build upon previous knowledge that you bring about pediatric nursing care and will prepare you for subsequent courses. My name is Shannon Scarisbrick, and I am pleased to be your instructor for the Pediatric Theory course. I currently work as the Regional Pediatric Clinical Nurse Educator for Central and North Vancouver Island. Having worked my entire nursing career in pediatrics and neonatal intensive care, I am passionate about the care of infants, children, and their families. I am eager to engage with you all as co-learner in this course. I have only worked in a larger urban hospital, so I am looking forward to learning from you all about the unique challenges that you face working in rural centers. I sincerely believe that this course can be the beginning of a transformative learning experience for all of us. Our course will consist of 5 modules: Pediatric Growth and Development, Common Pediatric Illnesses, Pain Management in Children, Care of Children with Complex Needs, and Pediatric Emergencies. As this course is a distance course, it will be delivered through a number of different modalities. Online presentations will be available each day. Online asynchronous discussion boards will allow participants to discuss issues and topics as they arise, and Blackboard Collaborate sessions will allow for discussion in real time. I hope that through these different modalities, we will enjoy 6 weeks of rich discussion and create a community of learning together. By the end of the course, my hope is that you will be able to discuss principles of family-centered care, identify stages of growth and development, discuss developmentally appropriate approaches to infants and children, describe and discuss common pediatric illnesses and treatments, and discuss aspects of pediatric emergency management. The required text for our course is the 9th edition of Wong's Nursing Care of Infants and Children. Wong's pediatric texts are widely regarded as the most comprehensive, authoritative source of information for nursing care of pediatric patients. It is my hope that this text will be useful to you not only for this course, but also in the skills course and the clinical experience. I believe that this text is a useful reference for any nurse who cares for pediatric patients. The recommended text is the Publication Manual of the American Psychological Association, 6th edition. It is an expectation that any written work will follow the style guidelines outlined in this manual. If you choose to not purchase this text, you can find information about the APA style guidelines on their APA style blog. As you can see from looking at our calendar, this is an intensive course. If you are struggling at any time, please do not hesitate to connect with me. I want you all to be successful and experience significant learning. Please refer to the syllabus and the course website for the required readings each day. Next, let's talk about how you'll be evaluated. Your evaluation will be ongoing throughout the course. You will be graded as successful or unsuccessful upon completion. In order to be successful, you must complete each component of the course. Please refer to the syllabus for specific grading information about each assignment. The first component is participation in the Blackboard sessions and in the daily discussion boards. These, in essence, take the place of traditional classroom setting where discussion takes place in real time. By participating in these online discussions, we will be able to create a community of learning that will be a source of support as we move through the theory course and move on to the skills course and clinical experience. The second component is the Philosophy of Family-Centered Care paper. This assignment is not intended to cause a great deal of stress, and I hope that you enjoy the opportunity to reflect and create your own philosophy of this important concept. Family-centered care is a theme that is woven throughout this curriculum as it touches every aspect of pediatric care. This will provide you the opportunity to reflect on your own values, beliefs, and assumptions about family-centered care, and then to describe your own personal philosophy of family-centered care. Please ensure that this paper follows the APA style guidelines and cites all references accordingly. The next is the case study presentation. This assignment provides an opportunity to think about scenarios that you have either seen in the past or might see in the future in your place of work. I would encourage you to be as creative as you can be in developing your case study. Please think about aspects of pediatric care beyond simply the diagnosis and treatment. Perhaps you could create a scenario about a child with a unique family situation. These case studies will be presented during the Blackboard Collaborate session in week 4, and following each presentation, you will have the opportunity to facilitate a 10 to 15-minute discussion about the case study with the class. The final component is the learning portfolio, which is for your own learning and self-reflection. It is a way to document your journey through the course process and to create a resource for you to use in the future. Please feel free to select a format that is most useful to you. If you have any questions about a format, please do not hesitate to connect with me. Finally, we must talk about academic integrity. Honesty and integrity are important in both nursing and academics. I expect that you will display the highest levels of integrity. Plagiarism and other forms of academic dishonesty will not be tolerated and will result in dismissal from the course. All work must be original and individual. Please cite all references as per the publication manual of the American Psychological Association, 6th edition. So with all of that out of the way, let's get started. Let's begin our journey into pediatric nursing.